Hey everyone, it's your channel name, and with flu season upon us, I wanted to talk about how to stay healthy and protect yourself from those nasty respiratory infections that can really knock you down. We're talking about influenza and pneumonia, two illnesses that can share some similar symptoms, but are actually quite different. First, let's quickly break down what influenza and pneumonia are. Influenza, or the flu, is a viral infection that affects your respiratory system, nose, throat, and lungs. It's highly contagious and can knock you out for days. You know the feeling, that sudden onset of fever, chills, muscle aches, and that overall feeling like you got hit by a truck. Pneumonia, on the other hand, can be viral, bacterial, or fungal, and it inflames the air sacs in one or both lungs. It's more serious and can be life-threatening, especially for children, older adults, and people with weakened immune systems. Pneumonia often starts like a cold, but then progresses to a persistent cough, difficulty breathing, and chest pain. It's super important to know the difference between these two and take the right steps to protect yourself and your loved ones. Let's kick things off with the most effective way to prevent both the flu and pneumonia: vaccination. Think of vaccines as your body's personal bodyguard against these infections. They introduce a weakened or inactive form of the virus or bacteria, teaching your immune system how to fight it off if it ever encounters the real deal. Now, the flu shot is something you should be getting every year, ideally before flu season hits its peak. Why? Because the flu virus is a bit of a shapeshifter, constantly mutating. Every year, scientists develop a new vaccine based on the strains they predict will be circulating. So, getting your annual flu shot ensures you've got the most up-to-date protection. When it comes to pneumonia, there are a couple of different vaccines, and the one that's right for you depends on your age and health history. The pneumococcal vaccine, for instance, protects against pneumococcal bacteria, which is a common cause of pneumonia. It's especially important for young children, older adults, and those with weakened immune systems. I know some people have concerns about vaccines, and that's totally understandable. But I want to assure you that vaccines undergo rigorous testing and safety protocols. They're monitored for side effects, and the benefits far outweigh any potential risks. If you have any questions or concerns, please don't hesitate to talk to your doctor. They can provide you with evidence-based information and help you make the best decision for your health. Remember, getting vaccinated isn't just about protecting yourself. It's also about protecting those around you who might be more vulnerable to these illnesses. It's about community immunity, looking out for each other, and preventing the spread of these infections. All right, let's move on to another crucial aspect of preventing flu and pneumonia: good hygiene practices. I know it sounds basic, but trust me, these simple habits can make a world of difference when it comes to keeping those germs at bay. First up, the golden rule of hygiene: hand washing. You've heard it a million times, but it's worth repeating. Wash your hands frequently throughout the day, especially before eating, after using the restroom, and after being in public places. And when you wash, do it right. Use soap and water and scrub those hands thoroughly for at least 20 seconds. That's about the time it takes to sing happy birthday twice. Make it fun. Make it a habit. Now, I know it's tempting, but try your best to avoid touching your face, especially your mouth, nose, and eyes. These are the entry points for germs, and touching them with unwashed hands is like giving those little buggers a free pass into your system. If you happen to cough or sneeze, do it the right way. Cover your mouth and nose with a tissue or your elbow, not your hands. This helps prevent those respiratory droplets from spreading through the air and infecting others. And please dispose of used tissues properly. Another thing that often gets overlooked is keeping frequently touched surfaces clean and disinfected. Think about all the things you touch throughout the day: your phone, doorknobs, light switches, keyboards. These surfaces can harbor germs, so it's a good idea to wipe them down regularly with a disinfectant wipe or spray. Chapter 3: Masking up and social distancing. Still relevant. Now, even though we're past the peak of the COVID-19 pandemic, it's still a good idea to incorporate some of the preventative measures we've learned into our daily lives, especially during flu season. I'm talking about masking up and practicing social distancing, especially when you're in crowded or poorly ventilated spaces. Think of wearing a mask as an act of kindness, not just for yourself, but for those around you. It's a simple barrier that can help reduce the spread of respiratory droplets, which is how both the flu and pneumonia viruses are transmitted. If you're feeling under the weather, even if it's just a sniffle, wearing a mask is a considerate way to protect others. Social distancing might seem a bit outdated now, but it can still be helpful, especially if you're in a high-risk group or interacting with someone who is. Maintaining a bit of distance from others, especially those who appear sick, can reduce your chances of being exposed to the virus. Remember, these precautions aren't about living in fear. They're about being mindful and proactive about our health and the well-being of those around us. Chapter 4. Early Detection. Spotting the symptoms and seeking help. Now, let's talk about what to do if you start feeling under the weather. Recognizing the early symptoms of both the flu and pneumonia is crucial because it allows you to take action sooner rather than later. With the flu, you'll typically experience a sudden onset of symptoms, like feeling like you got hit by a truck. We're talking fever, chills, muscle aches, fatigue, headache, sore throat, cough, the works. It can be pretty debilitating, and you'll likely need a few days to recover. Pneumonia, on the other hand, can be a bit sneakier. It often starts like a common cold with a cough and runny nose, but then it progresses, and you might experience a high fever, chills, chest pain, difficulty breathing, and a cough that produces phlegm. In older adults, confusion can also be a sign of pneumonia. So, when should you seek medical attention? If you experience any of the following, it's essential to reach out to your doctor or healthcare provider right away. Difficulty breathing or shortness of breath, chest pain, a high fever that doesn't go down with medication, confusion, or bluish lips or fingernails. Remember, it's always better to err on the side of caution and get checked out by a professional if you're feeling unwell. They can determine the cause of your symptoms and recommend the best course of treatment. Chapter 5. Fuel up your immune system. Top foods to fight the flu. Now let's talk about how to give your body the best fighting chance against these infections. What you eat can play a big role in boosting your immune system and helping your body fight off infections. So, let's dive into some of the top foods to include in your diet during flu season. First up, we've got citrus fruits like oranges, grapefruits, lemons, and limes. These are packed with vitamin C, an antioxidant that helps support immune function. Vitamin C helps your body produce more white blood cells, which are the ones that fight off infections. Next, let's talk about leafy green vegetables like spinach, kale, and collard greens. These are loaded with vitamins, minerals, and antioxidants that support overall health and immune function. They're especially rich in vitamin A, which is important for maintaining the health of your respiratory system. Garlic is another great one to add to your diet. It contains a compound called allicin, which has been shown to have antiviral and antibacterial properties. You can add garlic to stir-fries, soups, stews. The possibilities are endless. Ginger is another ingredient with potent anti-inflammatory properties. It can help soothe a sore throat, reduce nausea, and boost your immune system. You can enjoy ginger in tea, stir-fries, or even add it to smoothies. And last but not least, make sure you're staying hydrated by drinking plenty of fluids, especially water. Fluids help flush out toxins, keep your mucous membranes moist, which helps trap germs, and support overall immune function. Chapter 6. Stay healthy and thrive this season. So there you have it, your guide to staying healthy during flu and pneumonia season. By following these precautions and making smart dietary choices, you can give yourself a better chance at avoiding flu and pneumonia, or at least recovering faster if you do get sick. Remember, Prevention is always better than cure. If you have any questions or concerns, please don't hesitate to reach out to your doctor or a healthcare professional. They're your best resource for personalized advice and guidance. Thanks for watching.